This is a brief video providing an overview of what we're looking for in terms of consultation structure and what we're trying to achieve as a practitioner at each stage of the consultation structure. So the basic structure of a consultation is that we need to open it. So the focus of this is setting the tone for the consultation to maximise the likelihood of positive contribution from the patient that will then facilitate shared decision making. We then move to information gathering, and the opening of the consultation really contributes to how effective we are at information gathering, because if we set the tone at the opening stage that we're expecting the patient to actively participate in the consultation, then they are facilitated to make a meaningful contribution rather than it being a bit of a nasty surprise when the practitioner moves to information gathering. Once we are satisfied that we have a full picture, including physical examination, then we can make a diagnosis and establish the treatment options to present to the patient. And so we move to the information giving phase. Now, the information giving regarding the diagnosis and treatment options can be framed using the most appropriate language for the patient, which of course we learned during the information gathering phase. Now, the information giving should also be presented in the context of the patient's attitudes and beliefs that were also learned during the information gathering phase. So this is why it's so important to gather a full picture before giving any information. So we now have the foundations for effective shared decision making, followed by closing the consultation. Now, this consultation structure is largely, and we've got building and maintaining rapport, of course, throughout. So this consultation structure is largely a one-way street, particularly that transition between information gathering and information giving. So that's this phase here. We really shouldn't be making any decisions until we've established all of the necessary information. And remember that providing advice, for example, about lifestyle is an intervention and therefore should only happen once information gathering is complete.